I'm Dr. Nan Boss at Best Friends Veterinary Center, talking today about anesthetic safety in dogs. So there are quite a few risks of anesthesia. That's always the thing that pet owners worry about the most whenever we are doing any sort of surgery or dentistry on their dog. I'm going to go through some of those risks and what we do to try to minimize them. First thing that we're going to do as far as the procedure goes is have you give your dog some anti-anxiety medication prior to bringing them in the hospital. So this has multiple benefits. Even if your dog is not particularly frightened or anxious when they're in the hospital, they are still going to be excited. Their adrenaline is going to get going. That adrenaline is going to increase the amount of anesthetic drugs that we have to use. It's going to make it harder for us to get the IV catheter in and do some of the pre-surgery procedures that we need to do. So we're going to use that trazodone. If your dog is really anxious, we may do something in addition to trazodone to help make your dog more comfortable while they're here in the hospital. It is kind of a scary procedure day for many pets. They are not always happy to be here in the hospital. We try to make things as calm and comfortable for them as possible, and the anti-anxiety medication is a key part of that. The other things that we will do before anesthesia, we are going to do a complete blood count and a chemistry panel. We want to make sure if there's any other disease process going on other than the one that we are treating, that we are addressing that. The liver and the kidneys are responsible for processing anesthetic drugs, so if we have a problem with those organs, then we may need to adjust our protocol. There are some forms of kidney and liver disease that can start at a very young age, so even pets coming in for spays and neuters can have abnormalities on their blood work that would require us to change things or sometimes even postpone their procedure while we address a problem. Some breeds of dogs have specific liver problem that we are testing for, where some of the blood supply to the liver goes around the liver instead, so the liver is stunted and undernourished and tends to not process anesthetic drugs very well. So there's a specific test called bile acids that we will do for those breeds. That's usually Schnauzers, Yorkies, Malteses, and some of the related mixes. Although we can see liver shunts in any breed, those are the ones that we routinely screen for liver shunts because it's so common in those breeds. There are some genetic forms of kidney disease. We see that once in a while in golden retrievers, where they are already in kidney failure when they come in at 6 or 7 months of age. So that's something we want to be aware of. And of course, as pets age, their liver and kidney function declines naturally, and they're more prone to have organ damage along the way. The complete blood count makes sure that we don't have any sort of infection or anemia, some problem that would make us want to postpone the procedure until we fix it. We've occasionally caught cancers this way, and of course you're not going to go ahead with a procedure if you've just diagnosed a cat or dog with lymphoma or some other type of cancer. So we want to make sure that everything's good with their blood work. The next organ that we need to be thinking about is the heart, and there are quite a few different types of heart disease in dogs and different screening tests depending on what we are looking for. So some breeds will again start with their heart disease very young, and again, genetic forms of heart disease, like genetic forms of liver and kidney disease, can start very young. There are some forms of heart disease that show up as an irregular heart rhythm. A heart that's normal during normal circumstances can fail when it's under stress, such as heavy exercise or anesthesia. So an ECG screen to look for an abnormal heart rhythm is one of the most important things that we recommend before we anesthetize your pet. Some breeds will have heart disease but have a very normal ECG. So for some breeds that are prone to cardiomyopathy, we're going to do other tests in addition to or instead of the ECG screen. So some of the giant breeds like Great Danes and Mastiffs, also Doberman Pinschers, boxers are prone to specific kinds of heart disease, and for those we would want to do a test that we call the proBNP, which is a heart muscle enzyme. That enzyme level is going to go up if the heart is stretching and those heart cells are damaged. So we may recommend that. Dogs that have valvular heart disease, so they have a heart murmur because a valve is leaking, those dogs we generally want to take a chest x-ray and look for heart enlargement or fluid in the lungs because the heart is not pumping properly. So we may end up recommending one test for your particular pet or multiple tests, but we want to make sure we know exactly what we are dealing with before anesthesia. And if we find a problem, we're likely going to cancel or postpone the anesthetic event, and we'll figure out what's going on with the heart and come back later. So the most common cause of death under anesthesia is an undiagnosed or unexpected heart problem. So we're going to look really carefully for that. Pain medication is an important component of anesthesia. The more pain a pet is in, again, the more adrenaline and cortisol is in their system, the more anesthetic drugs we're going to need, and then that's going to delay the recovery. Pain medication also reduces the risk for incision infections afterwards. So the pain medication reduces the inflammatory chemicals that are in the pet's system. You're going to have less risk for infection, less swelling, less inflammation around the incision. There are several other things that we do to reduce inflammation as well, like using the surgery laser for cutting and the therapy laser to reduce swelling afterwards. And we'll talk to you about those things when we actually discuss the surgery itself. There are several things that happen inevitably with anesthesia. They're just part of the anesthetic process. That's a decrease in their body temperature, a decrease in blood pressure, decrease in heart rate, decrease in respiratory rate. So those are the things that we are monitoring while the pet is under anesthesia, and we're working really hard to keep those as normal as possible. So for low blood pressure, we're always going to have an IV catheter in place and be administering fluids. So if your pet's blood pressure gets too low, we're just going to increase the fluid rate and pump some more fluid volume into the blood vessels to keep that blood pressure up. For temperature, we use various warming devices, pads underneath them, hot air blankets that blow warm air onto your pet. We'll put booties on their feet and little hats on their heads so they don't lose so much heat out of their heads and their feet. The ears are another place that pets will lose heat, so we try to keep those warm as well. The fluids that we administer are warm, so there's always a warming device on the IV line to keep the fluids warm as well. So we are going to work very hard to minimize that drop in temperature. And we're going to continue to monitor blood pressure and temperature even after we're done with the anesthetic until they come back to normal and we're sure that the pet can come off its IV fluids and does not need the supplemental heat anymore. Respiratory rate we will monitor pretty closely. There are some anesthetic drugs that can cause the pet to stop breathing altogether for a few minutes, so we may have to give oxygen to the pet artificially for a few minutes while that drug is processing through their system. There are pluses and minuses to all of our different anesthetic drugs. So the anesthetics like propofol and alfaxan that reduce respiratory function are also much easier for the kidneys and the liver to process, and they cause less consequences for the heart. So in some ways it's a safer anesthetic drug, and in some ways we have some things we have to monitor and adjust for. Other anesthetic drugs have better pain control, which is important anytime we're doing dental extractions or some kind of surgery, but also are harder for the liver, the kidneys, or the heart. And so we're always trying to balance all of that out and pick the perfect anesthetic plan for your pet based on its breed, its age, and what our blood tests and heart testing is telling us. So we are going to have a little conference at the beginning of each anesthetic day, and we're going to go through our procedures and decide what anesthetic drugs are appropriate for which pet, so my technician knows exactly what to get ready. And that brings up another really important point, because I want my anesthetic patients to be monitored by an experienced technician. We do not want our two new graduate technicians, Hope and Remy, to be immediately thrown into the fire and be expected to do all the anesthetic monitoring and keeping track of breathing and keeping track of whether the monitors function correctly and the anesthetic machine is functioning correctly, and is the temperature and the blood pressure okay. There's a lot of things that they have to be keeping an eye on, and it's a lot for a new graduate person. So our younger technicians are always going to be mentored and monitored by one of our more experienced technicians. So this is a huge safety factor. It matters a great deal who's watching your pet while it's under anesthesia. Your pet is going to probably go home a little sleepy after its procedure. Depends on whether we keep your pet overnight or whether it's a procedure that they can go home with the same day. Usually we try to have them awake enough that they are walking around fine and are able to start getting water and food when they get home. We may have you wait a little bit before you start water or food, depending on how long it's been since the last anesthetic drug was given. So we'll talk to you about that when you pick your dog up. Usually we're going to call you the day after your pet goes home and make sure that your pet recovered normally and that everything is good. We'll talk to you at the discharge about pain medication and what to do with that and when the next dose needs to be given, antibiotics, any other anti-nausea medication, other things that might be going home with your pet. I should mention too, there are some breeds of dogs like bulldogs that have a very flat, squished in face. We call that brachycephalic. Those dogs will have higher risk for regurgitating under anesthesia and aspirating the stomach fluid that they bring up. So those dogs are going to get anti-nausea medication the night before and the night of their procedure to make sure they're not nauseated when they're under anesthesia. Those dogs are also going to be intubated, so the breathing tube that gets put down their throat is going to be inserted by the veterinarian so that we can look at the soft palate, which is often too long in those short-faced dogs. So it's going to hang down into the airway, make it harder for them to breathe, also makes it harder to get the tube in their throat. And we're going to call you if that palate is long enough that we think it should be surgically shortened. So that's something we are always on the watch for those dogs. Pugs, boxers sometimes, Boston Terriers, all of those breeds that have a really short face. So that's an extra anesthetic risk. There was actually a study recently that showed that dogs with long noses actually have higher risk under anesthesia than the average dog. So that'd be like greyhounds and collies. And so we've started watching those dogs a lot more closely too, because apparently they don't do as well under anesthesia as some other breeds. We've known for years that the sighthounds like Irish wolfhounds and greyhounds and whippets have some difficulty processing some types of anesthetic drugs. We don't use those drugs in our normal routine anymore, so that's usually not a factor in anesthetic. We've gotten away from using pentobarbital and phenobarbital and other barbiturate drugs that they are sensitive to. So I think that pretty much covers anesthesia. If there's more pertinent things that pertain to your dog specifically, we'll talk to you about those ahead of time. Otherwise, we're going to send you home with the appropriate medications to start with before surgery. Hopefully, you can get those into your pet with just a little meatball of food so they come in on mostly an empty stomach, and we should be good to go.